and currently practices in the post-anesthesia care units at the University of Maryland Medical Center and the trauma surgical intensive care unit at the University of Maryland Capital Region Medical Center. Is a commissioner for health serving with the Maryland Healthcare Commission and a pioneer board member and research committee of the DNPs that's doctors of color, I think. Dr. Akintade is the founder of the Health for Nigeria, a nonprofit organization that aims to provide accessible primary health care services for all Nigerians, regardless of their socioeconomic status or location. In November 2020, HFN initiated a program called the Nurses School Program to renovate spaces in rural public secondary schools in various locations around Nigeria as fully furnished sick bays and deploy registered nurses to care for students, teachers, and rural community in these locations. So far, in the completed 5 programs, over 7,000 students, 1,000 teachers and staff and community members have seen, screened, or been treated so far. That's very, very huge achievements. Kudos to HFN and to Dr. Akintade. Shannon, I met very recently. I mean, it's been, so far, I think she's such an amazing lady. I went through her bio. It's full of huge accomplishments. So Dr. Idzik, I hope I got that pronunciation correctly. Dr. Idzik is an associate professor at the University of Maryland School of Nursing. Prior to her current role as the associate dean of the DNP program, she served as the program director for the Adult Gero Primary Care NP program and the director for the DNP program. She's active in the professional community, serving as a collegiate commission on nursing education, site visiting and assessing schools for accreditation. She was a member of the American Association of the College of Nursing Doctors of Nursing Implementation Task Force and has been an exam item writer for the American Nurses Credentialing Center Adult Gerontology Nurse Practitioner exam. Dr. Idzik has served on the executive board of the National Organization of Nurse Practitioner Faculties and is the non-PF representative of the current revision of the National Task Force criteria for evaluation of NP programs. The 19-member task force that sets the national standard on NP education in US. She's also a member of the special non-PF working group, identifying characteristics of not just quality NP programs, but exemplary NP programs. In addition to her academic expertise, she has a long history of practice expertise. She has worked in endocrinology, emergency care, preoperative services, and diverse primary care and outpatient practices from inner city Baltimore to more rural Harford County, MD. She currently maintains a faculty practice as a nurse practitioner in the University of Maryland Upper Chesapeake Medical Center in the Comprehensive Care Center, where she cares for uninsured, underinsured, and medically complex patients. Because of her clinical expertise, she has served as a president of the Nurse Practitioner Association of Maryland and subsequently led recommendations to remove scope of practice barriers for advanced practice nurses of the Maryland Action Coalition, which is part of the Future of Nursing, for more than 5 years now. She has served as an appointed member of the Maryland Health Services Cost Review Commission, Physician Alignment and Engagement Workshop, and serves as the nurse practitioner representative to the Regional Health Information Exchange, CRISP. Nice. She spent the past 3 years serving as one of the 11 federal members and the only NP of a federal advisory commission to make recommendations to the United States Congress on diabetes care in the US and serves as the endocrine specialty interest group for AANP. Dr. Idzik is an avid publisher, has been a reviewer and editorial board for numerous peer-reviewed journals, and has millions of dollars grant funding. In addition to her national and international work, not a day goes by that she doesn't mentor a junior faculty or a student in NP. truly believing in their success. And, that is what people need these days. You won't be surprised after hearing that she was awarded ANP State Award for Excellence in 2012, received the Non-PF Policy Award in 2015, and was selected as a Fellow of the American Academy of Nurse Practitioners in 2014. Also a Fellow of the American Academy of Nursing in 2017. In her spare time, she serves as a great friend to Dr. Akintade and thrilled that she is willing to join us today. As you can see in her bio, she is exceptional. You couldn't pick 10 national authorities on matters involving APRNs without giving her strong consideration. I would say you would pick her as one of the top 5. So welcome, Shannon. I mean, it's so great to have you here. Your expertise is wow. I mean, I read that, I think it was just yesterday that I had the review. It is amazing what you do. Thank you so much for all that you do.
Thank you, Sheila, very much. I appreciate that. Dr. Akintade, do you want to start?
Yes, Dr. Akintade, we would like you to start with your own brief.
All right, so well, thank you very much, everyone. Once again, I actually started by chatting in the chat box, just trying to thank everyone. Obviously, I don't want to distract or take away time from this wonderful presentation, but thank you so much for taking the time this morning to join us. Health for Nigeria is a very small nonprofit organization, with lofty goals. And we definitely are leveraging on, every resource possible, to try to accomplish this goal. So, I put this slide up just saying, vision without action is merely a dream. Action without vision just passes time, and what we're hoping to accomplish is vision with action, and our own way to change, even if it's just a small part of the world, and credit to Joelle Baker. So Shannon, you can move to the next slide, please.
Sorry, Ben.
No, that's okay. So just a little bit about Health for Nigeria, and I promise you I will get out of the way. We're here to listen to Dr. Shannon Idzik today, not me, but I would also just like to share what our mission and our vision is. Once again, small organization with lofty goals. Our mission is to mobilize a movement of healthcare leaders expanding access to high quality primary medical care services to all Nigerians. We know we have significant challenges in this area, and our vision and how we intend to accomplish that, obviously is, or at least our vision is basically, what we would like to get out of this, is a Nigeria where all people, regardless of their geographic or socioeconomic status or circumstances, can access high quality and affordable primary medical care services. You can move to the next slide, Shannon. We have several initiatives that include one like we're all present at today, our monthly lecture series. We send out monthly newsletters. We've hosted a panel discussion. We're hoping to be able to provide a leadership and management certification program at some point for healthcare leaders in Nigeria. But our flagship program is the Nurses School program. That's actually one we're very excited about. It was envisioned in July 2020 in the middle of the pandemic, just to support schools in Nigeria as they dealt with students going home and coming back into the school system. And the goal was to fill the healthcare gap in rural public schools around the country. If you really think about it, rural public, that's also a service to the community, which is what ended up happening. We utilize a bottom-up approach to solve inherent healthcare problems in underserved communities by establishing sick bays or a clinic in these schools. We establish a health club that will promote healthcare awareness among students, and we deploy a registered nurse to these communities. And our registered nurses have 5 very important responsibilities, and these keep growing. It started as 2 or 3. So COVID-19 education and resilience building in these schools. They provide basic first aid, health awareness promotion and disease prevention via the school health club. They visit students at home with chronic diseases and do some teaching with families. And one of the things we're most impressed by or proud of is our community engagement. Our nurses go into the community and conduct screenings. And the first school launched in Ibadan, Oyo State in November 2020, and we're up to 5 right now. We're renovating 2 more before the end of the year. We'll have 7. We've seen over 7,000 students. And in terms of faculty, staff, and members of the community, we've also seen probably about another 1,000 students or individuals. So thank you very much. That's a little bit about who we are. We thank our sponsors and everyone who's been a part of this. And once again, thank you for coming. I'll hand it back to Shannon.
Thank you so much, Dr. Akintade, for making that brief, because I know HFN is doing so much. Just before I hand over to Dr. Idzik, I would just like to do like a little bit of housekeeping. So everyone, we will be having this program as a muted one for the most part. So we want to make sure that all of the packed information that Dr. Idzik will be giving us today, we would be able to take everything in without a lot of interruptions. But if you have questions, we encourage you to use the chat box. Some of the questions we may be able to even respond to over the chat box, and the others we will present to Dr. Idzik after the program. Dr. Idzik will tell you a whole lot of information about nursing and possibilities here. I encourage everyone to take notes and as much as possible wait to hear a lot of the presentations before you ask questions. But if you have questions right in the middle, you can also put it in the chat box and she will take it over from there. And she will tell you that this is only going to be the first of series of conversations that we will be having about this. So Dr. Shannon Idzik, I think the floor is yours now.
Thank you very much, Ola and Bim. I really appreciate it. So for those of you who don't know, Bim and I have worked together for, I think, 11 or 12 years now. So great colleagues, and I'm thrilled to be here to talk to all of you. We've collaborated on advanced practice nursing together for many years, and now we're together in our associate dean roles, sharing the work of the school and now this, which is really exciting to me. So as Shola mentioned, I'm Shannon Idzik. I am the Associate Dean of the Doctor of Nursing Practice Program at the University of Maryland School of Nursing. And what that means for us is that I oversee all of our advanced practice nursing programs at the school, nearly 620 advanced practice students. It's quite a large program, and I'm thrilled to be able to do that as well. So when Dr. Akintade and I started talking about Health for Nigeria, he shared with me some of the amazing work that Health for Nigeria is doing and some of the future goals, particularly around healthcare workforce. And he talked about his dream and the vision of the organization to increase access to healthcare, specifically through nursing, advanced education for nursing and advanced practice nurses. And as we began to talk about this presentation, we both knew one thing. I am in no way an expert in Nigeria or in Nigerian healthcare or the Nigerian healthcare system, but he knew that I really have spent probably almost half of my life educating advanced practice nurses, particularly nurse practitioners. And so he asked me to come and talk about the topic. I'm sure there are probably some of you here today who spent your life working alongside of me doing the same. There are probably others of you who work either as advanced practice nurses or work with advanced practice nurses. And there are others of you who may have heard of advanced practice nurses, but really may be unfamiliar with their education, their use across the globe, their clinical outcomes, or really have had little interaction with them. And what I've learned in my advanced practice career, particularly my career in advanced practice education, is that the complexity of advanced practice nursing that often seems kind of secondhand to me can be really confusing to people. And at times, just shocking, actually. And just earlier this week, Dr. Akintade and I sat and we were talking to a candidate about a secretarial position at our school. And because the position was going to support, advanced practice nursing in some way or another, I was explaining a little bit about it to the candidate. And it became really clear to me that she had a lot of misperception about the roles of advanced practice nurses in the United States. And that is in a country that's had a solid advanced practice foundation for really almost 100 years. So there have been other times where I've talked to medical colleagues in other countries who are shocked that, I, as a nurse, have the ability to prescribe medications so I can diagnose diseases, order x-rays, and even run my own primary care practice. So I think it's important to really set the stage for, what are advanced practice nurses, what can they do, what is their education like, and how are they being used across the globe. And while we're very aware that there have been efforts to infuse advanced practice nursing into Nigeria in the past, and for many, this isn't the first time you've heard of it, but Nigeria still doesn't have an advanced practice nursing infrastructure. So continuing these conversations is really important. And as Shula mentioned, and Ben mentioned as well, this is hopefully not the last conversation. This is the first of many conversations that Health for Nigeria is hoping to have about advanced practice nursing. My goal today is really to just start the conversation. After today's talk, we really hope to answer some questions that you might have. Some of the questions we might have answers for, but there are probably many others that we won't. I never claim to have all the answers. I feel like when I do that, it'll probably be time to retire, or I don't know, do something else. And the next several months, Health for Nigeria really hopes to host panels of experts, if there's an interest in advanced practice nursing in Nigeria, who have recent experience on developing NP programs or advanced practice programs in Africa and other countries, as well as those with health policy and healthcare experience in Nigeria. So on behalf of Dr. Akintadi, I would like to extend a welcome to you, to those, if in fact there's an interest for them to go on. So our objectives today are really to discuss current healthcare issues briefly in Nigeria. Again, that's probably for many of you your area of expertise, but define advanced practice nursing, talk about the different roles of advanced practice nurses, describe the education of nurse practitioners, discuss studies that describe outcomes of nurse practitioners, some examples of success in the healthcare system, and talk about what might be some next steps. So when we think about, really kind of why we're here today, it's really about the current reality of healthcare in Nigeria. And while it can be kind of challenging to get some precise data on the healthcare indicators in Nigeria, we know that there are certainly some concerning metrics. And a lot of it just depends on how you slice and dice this information a little bit. But we know that the amount of money that Nigeria is spending on healthcare is just barely above what the World Health Organization considers as viable. We know that infant mortality rate is high, that child mortality rate is also high. Maternal mortality rate is also high. I read somewhere that it accounts for almost 20% of global maternal mortality, which is really shocking. Life expectancy, depending on where you pull your data, ranges from 53 years to 60 years old, lower in men than in women. When you look at the World Health Organization data, they kind of give us a number of 55.2 for Nigerian life expectancy, which again is shockingly low. There are lots of other things going on in Nigeria. We know that a fair amount of money is spent in Nigeria on medical tourism, where Nigerians leave the country to go receive medical treatment abroad, outside of their country, and particularly in areas like oncology and orthopedics, nephrology, cardiology, and that Nigeria is really high on the list of African countries in terms of leaving the country to get healthcare. There are significant healthcare provider shortages. And again, there are varying numbers out there on what the World Health Organization recommends, but there is some suggestion that there is about 1 to 400, should be about 1 to 400 healthcare providers per people. So for every 400 people, there needs to be a healthcare provider, and that can be a broad definition of healthcare providers. But certainly Nigeria is far from that number. So we know there's, again, depending on the numbers, 25 to 35,000 medical doctors in Nigeria, which is a 1 to 5,000 ratio. and enough nurses to be about a 1 to 1,300 ratio. So certainly not at the 1 to 400. And now, of course, there are other providers of care in Nigeria, pharmacists and other individuals, but still certainly a healthcare provider shortage. One of the other things that's going on, which is common in African countries right now, is what they call task shifting. It's the reallocation of healthcare tasks to individuals from individuals who have a higher level of skill to individuals who have shorter training and lower qualifications. And we certainly know that that's occurring in Nigeria. And nurses and other healthcare workers are being asked to, or are having tasks shifted to them that they may or may not have proper training to do safely and effectively. And this potentially has a negative impact on healthcare outcomes in Nigeria. So what needs to change and why? And really what it boils down to, all of these things kind of come together. There's a lack of primary medical care, we know, in Nigeria for, again, a variety of reasons: inadequate health system structure, other social and economic factors, medical professionals, limited access to health care for underserved individuals, lack of primary care access, and healthcare needs are just not being met for a significant portion, almost half of Nigerians having difficulty getting primary healthcare services. And in order to improve healthcare, we have to find clinicians to care for people and healthcare providers to care for people. By improving healthcare, it certainly will improve many aspects of Nigerian quality of life. So one of the things I always like to talk about, and this was a perfect example of why I think it's so important, and as Dr. Akintagidi talked about the mission and vision of Health for Nigeria, I think it fit perfectly. So, before we talk a little bit more about advanced practice nursing, I wanted to talk a little bit about a book that I read at one point. I've listened to this TED Talk, and it really was, frankly life-changing for me, and how I approach things that I'm particularly passionate about. I have a lot of passions. One of them is advanced practice nursing, which is the reason I'm here today. And BIM knows, but there are a lot of other things to be passionate about. And I'm sure many of you have kind of wondered, or I've always wondered, and after I read this, I thought, that really makes a lot of sense. But why some things are so successful and other things, frankly, aren't. And certainly, don't get me wrong, I'm not saying that these principles are the only ingredients to success, but I hope that you'll think about some of these concepts as you think about leading healthcare change in Nigeria. If you haven't read the book or watched the TED Talk by Simon Sinek called How Great Leaders Inspire Action, I would love for you to do, at least listen to the TED Talk, maybe even listen to the book. Some of it will sound familiar, as I've said, here today. But you are all here today, either, as leaders in some capacity, either leaders of organizations, leaders of businesses, leaders of families and communities, maybe even aspiring leaders preparing to make some, big, great change, at least we hope. And as you listen today, I want you to think about how your plans move forward and your questions for today. And I want you to kind of keep coming back to the slide. And if you take nothing away from today, I want you to kind of take this away. In his book, he says that really all great leaders think, act, and communicate in one way. And it's all the same way. That he really investigated many organizations and many leaders, from Apple to the Wright brothers to Martin Luther King. And what he found is that, again, they all communicate the same way. And they don't communicate what they buy or what they're trying to sell or what they're trying to lead you to do, but why they do it. And that people don't follow people because of what they do. They really only follow you because of why you do it. So, and he uses Apple as one example. There are lots of examples, but I think it's a great, example to use, because I think many of us know Apple computers, Apple phones, Apple things, all the things that they make. And these leaders, know what they do. They build computers, for example, and they know how they do it through some kind of microprocesses, but not all companies actually tell us why they do it. What's their purpose? What's their calling? And he uses this as an example. And he says, great companies and great leaders start from the inside out, and they tell us why they do it first. And then they tell us how they do it and what they do. So for example, Apple would say to us, we really believe in changing the status quo. We believe in thinking differently. And so then they go on to tell you that they make simplistically designed computers and then hope you'll buy them. So changing the order around, starting with the why, really changes how people feel about what you're doing. And it makes them want to follow you rather than not. So I want you to think about that today as we go through things. And I think it was really helpful to me as I read the mission and vision of Health for Nigeria, and I think it fits perfectly. So as you heard Dr. Akintade talk about Health for Nigeria and the vision, he talked about the why. The why that we're here today, or the reason I'm here, the reason he asked me to be here, is he really has a dream, and the Health for Nigeria has a vision for Nigeria, where all people, regardless of their age and economic circumstances, can have quality and affordable healthcare. And the how we're going to do that, or you're going to do that, or he's going to do that, or Health for Nigeria is going to do that, is by mobilizing a movement of leaders to expand access to quality primary medical care for all Nigerians. And the what is the question I think we're here to talk about today, really. And to me, the question is really now the time to consider nurse practitioners as a way to improve healthcare for Nigerians. And so hopefully we'll get some, some insight into that as we go on today. We know that there are advanced practice nurses practicing literally all around the world. I mean, and when I say all around the world, I'll be honest, I had to do a little bit of prep work because we all get caught up in our own little activities, the things that we're working on. And so I spent some time really looking into, what's going on in advanced practice nursing around the world. And I will tell you, it's amazing. North America, both obviously the United States and Canada have advanced practice nursing. In Latin America and in the Caribbean, there are advanced practice nurses in Jamaica and Trinidad, Tobago, Belize, Montserrat, as well as Chile. In Europe, there's regulation for advanced practice nurses in 9 of 23 countries, including Austria, France, Greece, Hungary, Iceland, Ireland, Israel, Netherlands, and Norway. In Africa, there's a family nurse practitioner program in Botswana, and now in Tanzania, or there's a family nurse practitioners in Tanzania. South Africa has a designation for advanced practice nursing. Eswatini recently started a family nurse practitioner program, and Ghana has one as well. In Southeast Asia, Thailand has a robust advanced nursing program and have regulated advanced practice nursing. In the Mediterranean, Jordan has started to certify advanced practice nurses. Qatar has developed regulation for nursing practice, including midwives, nurse specialists, and nurse practitioners. Oman is also moving toward more formal advanced practice roles. And there's a board looking to regionally standardize advanced practice nursing throughout the Gulf Cooperation Council, including Bahrain, Kuwait, Oman, Qatar, Saudi Arabia, and the United Arab Emirates. So as you can tell, it is accelerating, in my mind, at a very rapid pace, which is really, really exciting. So when we talk about advanced practice nursing, what do we mean? And again, I know many of you know this, but I think it's important for us to make sure that we have, a common understanding. So what do we mean by advanced practice nursing? Advanced practice nursing are advanced nursing interventions that influence clinical health care for individuals, families, and populations based on graduate education and preparation for core competencies. So you might imagine then a advanced practice nurse would be someone who practices advanced practice nursing that has graduate education at a minimum of the master's level is recommended, and that they have expert knowledge in decision-making and clinical competencies in nursing practice. In the States, we use a term, advanced practice registered nursing in the United States. And that means for us, one of 4 advanced practice roles. And those are nurse anesthetist, nurse midwife, clinical nurse specialist, and nurse practitioner. So what are all of those roles and what are the differences? And again, many of you may be familiar with some of the terms, but there can be, I think, some confusion. And in particular, when we think about those advanced practice roles globally, sometimes they've been deployed in different ways across different countries. I think for most people, the role of the nurse midwife is relatively straightforward. You know, they're providing healthcare for women throughout the lifespan, really GYN care, family planning, conception planning, prenatal care, postpartum, childbirth, all components of care for women. Nurse anesthetists, I think, are also relatively straightforward. If you have interacted with them, they provide anesthesia during surgeries or in procedures. I think where it becomes a little bit more confusing is trying to differentiate sometimes the role of the clinical nurse specialist and the nurse practitioner. There was a study in 2008 comparing the clinical nurse specialist and the nurse practitioner, and they found that there really are quite a few common features between the two of them. But probably the main difference is that clinical nurse specialists tend to be more involved in non-clinical activities related to supporting healthcare, while direct care is common for both of them, the clinical nurse specialist and the nurse practitioner. Nurse practitioners really have more involvement in diagnosing, prescribing, and treating various conditions. And this recent study in 2008 really validated some prior studies about clinical nurse specialists and nurse practitioner practice. So nurse practitioners, and these definitions that I'm sharing with you, I know they're a little bit long, but they do come out of what we call the Aprn consensus model. And that is a document that came out in the United States to differentiate advanced practice registered nursing. And I will share that many countries, are using that as a guideline for definitions and scope for nurse practitioners and other advanced practice nurses. So nurse practitioners are well known across the world for their ability to provide physical exams, health assessment, diagnose, treat, and manage patients. And that includes ordering labs, imaging, as well as prescribing medication and equipment. One of the things that differentiates nurse practitioners from physicians is the focus on nursing practice. And so this is the practice of nursing, not the practice of medicine. And in particular, there's a focus on health promotion, disease prevention, and also on health education. And much like I shared the comments about, or the globe, how advanced practice nursing is around the globe, there's also a similar amount of nurse practitioners around the globe. As I mentioned earlier, they are in almost all of the continents. Many may think of nurse practitioners, predominantly in the Western part of the world, but really nurse practitioners are being deployed for the most part everywhere. According to the International Council of Nurses, there are numerous countries that they list as exemplar nurse practitioner models, including some of the countries that we have listed here. In other countries, there are also adaptations of nurse practitioner and clinical nurse specialist roles. So those, where they kind of have a blending, as I mentioned, there can be some, a little bit of role confusion there. But for example, Germany, also Hong Kong, Netherlands, and Singapore may have some types of blended roles. But not only are these countries there with models, there are other countries who are investigating or working toward nurse practitioner practice, including Tanzania. I recently read an article about a gentleman, Joseph Kilisara, who's a nursing faculty member at Kilimanjaro Christian University Medical University College in Moshi, Tanzania, who just recently graduated from the University of Botswana with a master's degree as a family nurse practitioner. He spent 2 years there in Botswana, and he's going to be helping them develop their family nurse practitioner program. So there are nurse practitioner programs, again, throughout the world, and in Africa, and in accelerating at a rapid pace. So I wanted to just kind of go through a couple of them, because I think it helps us, get this sense of, how long these things have been going on. So, Botswana had their first nurse practitioner program, their family nurse practitioner program in 1981. In order to enroll, they must have a nursing degree, a minimum of 2 years as a nurse, be registered, and have a certificate in secondary education. They work toward, in many areas, industrial settings, schools, in the community. And so when you think about how long this is almost 40 years. It makes me feel old, but it's almost 40 years. I think because I was born before that, it makes me feel old. So in Belize, they've had nurse practitioners for also quite some time, nearly 20 years, and psychiatric nurse practitioner program. It's a 2-year certificate program. It does not require a master's degree, but they're working toward really standardizing and role clarification. In the Caribbean, again, when you think about how long ago this was, in 1977, the first nurse practitioner program was started in Jamaica at the University of West Indies. It is really the main program in the Caribbean, but there's nurse practitioner practice in many other areas in the Caribbean, and they go to Jamaica to train and then come back and provide care in their country, which is exciting. So a more local to Nigeria is Eswatini. In 2007, they developed a master's family nurse practitioner program. Initially started off as a shorter program, but for a variety of reasons, much like the reasons Bib and I face here in Maryland, they offered part-time options for working nurses. And that was at the University of Eswatini. They have a broad scope of practice that was taken from US scope of practice, but then was revised to be more locally relevant to Eswatini. Chile is another example. I have a colleague who's been involved in developing nurse practitioners in Chile. So they have 2 advanced practice programs there in the University of the Andes and the University del Desarrollo. But she is working with a university that they call PUC, and I'll use that as the pronunciation. It will probably sound better. And they have brought 2 nurses and educated them at Boston College, and they've returned to Chile to develop a nurse practitioner program. The program hasn't been started yet, but they are working toward that. So again, there are other countries in other ways. And I think one of the reasons I wanted to share some of these stories is that many countries are sending their nurses initially to be trained in other countries, and then they're coming back as faculty members to continue to train nurse practitioners in the country. So when you start to think about doing this, I think one of the most prominent concerns people say, which is, I get it's a concern. It's always important to think about patient care. But what we know about nurse practitioner outcomes is that with proper education, nurse practitioners provide comparable services to those of physicians in terms of effectiveness and safety. They have been shown to decrease length of stay, improve patient satisfaction, decrease wait times, reduce hospital admissions, improve clinical outcomes such as blood pressure, blood glucose, symptom management, and many, many other things. There are hundreds of studies demonstrating their effectiveness and safety in providing quality care. And I think that's always important to remember as this moves forward. So obviously, that all sounds really great, right? Other people are doing it, it's happening around the world, they're safe and effective, but there are certainly barriers, right? We know that there are concerns. There was a study done in Latin America and the Caribbean looking at barriers and facilitators to implementing the advanced practice role there. And what that study showed was that the facilitators were seen, they surveyed 173 nurse leaders about their perceptions. And they said the facilitators were really, universities and higher education, the patient demand for primary healthcare, the colleges and associations that were pushing for it, and really the population's acceptance of primary healthcare. But the barriers were also significant, and they were, the current biomedical healthcare model, physician concerns, physician organization concerns, some of the working conditions and migration, and the idea that advanced practice nurses would substitute for physicians. And I think it's important to bring up these barriers as we, again, begin or restart this conversation, because these are barriers that will likely need to be overcome if there's interest in doing this in Nigeria. There was also a study in 2017 in Tanzania, where they interviewed 20 healthcare professionals about transitioning from what they call task shifting, which is in many ways an informal version of advanced practice nursing, to advanced practice nursing. And the interviews found some major themes. And the themes were actually pretty similar to those in the Latin American study. And while they weren't necessarily categorized as barriers and facilitators like that study, they did speak of very similar items. For example, they spoke about what I see as facilitators, which are the shortage of human resources for healthcare, the need for primary healthcare in the country, and innovation as being a facilitator. While they saw barriers also very similar to the barriers that we're seeing in Latin America, which include working conditions and concerns about physician opposition. So developing an advanced practice role in Nigeria will likely take a lot of time, a lot of conversations. And as the saying goes, Rome wasn't built in a day, right? The United States has been on this journey for more than 100 years, which is shocking to me when I think about the role of the advanced practice nurse having been around for more than 100 years. But the truth is, despite that, there are nurse practitioners that still have very stringent state practice requirements, even in our country. So I would imagine that it will take a fair amount of work to make this change elsewhere, as we're still trying to make changes today. But again, one of the things that's really critical is to go back to the why, and the why is access to care and improved health quality for Nigerians. So nurse practitioner education, what would it look like, or what does it look like? The International Council of Nursing has a paper out. It was actually published in 2020 on advanced practice nursing. I would encourage you, if you haven't read it, I'm sure many of you have, but take a look at it. It gives a great description about what really should be the standards. And obviously there's a lot of country context that's really important, and you can't ever leave that out because there will be varying abilities to meet some of this recommendations. But overall, the recommendation is that it is a master's degree with specific preparation for the nurse practitioner role. It's based on a common set of competencies, and there are a variety of published competencies out there about the nurse practitioner role. And importantly, it includes supervised clinical practice. There's a fair amount of clinical associated with a nurse practitioner role, and often it's around 500. With the concept of an education program, probably even before the education program, it's really important to sort out, what is the scope of practice? What would be the scope of practice for a nurse practitioner in Nigeria? What kind of policies and procedures would there be? What kind of competencies would they want to meet? What type of title protection? Who gets to call themselves a nurse practitioner? What's the scope of practice? What's or the job description, so to speak? But a lot to think about. But our goal here today was really to start this conversation, to kind of talk about what's been done across the globe, to really think about, is this something that individuals are interested in? I know I speak for my colleague Bim and his interest in Health for Nigeria. But if there is interest, Health for Nigeria's hope is to invite professionals with experience in starting nurse practitioners programs together for additional conversations, invite professionals with expertise in healthcare in Nigeria, and really to continue the conversations. I think if there is an interest, it will certainly take persistence. And I love this quote about persistence, and I think it's so applicable here, thinking about advanced practice nursing, and particularly as you saw our transition in the U.S. I was involved in the Maryland ability for us to have independent practice in the state, and it certainly took years and years and years of experience of persistence, trying hard to get legislation passed for nurse practitioners to be able to practice independently without supervision of physicians. But that came after, again, 50, 60 years of nurse practitioner practice. The saying is, a river cuts through rock, not because of its power, but really because of its persistence. And at this time, I would like to turn it over to Shola.
Awesome. Thank you so much, Dr. Idzik. It was a fabulous presentation. I tried to follow through as much as possible. Some of it went over my head, but it was really pretty amazing. And you mentioned quite a number of countries that are doing this, some of them sharing similar characteristics with Nigeria. It's difficult to see why we can't do it. I know you mentioned Tanzania, Liberia, Chile, South Africa. If they are doing it in these places, and Dr. Akintade, I would like your own take on this as well. Why do you think it's been difficult for Nigeria to be able to do this? Maybe difficult isn't the word, maybe challenging. And I think I read it in the chat box where someone said that, there are significant barriers. Do we have any insight to what the possible barriers would be? That's for both of you, Dr. Idzik and Dr. Akintade.
I'll go ahead and start. How's that? So, based on experience in other countries, I think, so I can't speak, I haven't talked to Nigerians specifically about this, other than, to be honest with you, Bim and some of my colleagues at the school. We're really fortunate, as Bim knows, we have a very large percentage of Nigerian students at the University of Maryland, which is exciting. We were talking about it yesterday, and I'm going to estimate that it may be as high as 10%. It's a large number, which is awesome. So we have a lot of people to kind of get feedback from. So I suspect, based on other countries' experiences, that there's likely physician opposition. That's probably one of the barriers. There's often concern about, are we going to be able to train them in our country? Do we have the capacity, to train or educate nurses at that level in order to be able to provide that level of care? Those are often probably two of the largest concerns I hear. Bim, what are your thoughts?
So I agree with your initial thoughts. I mean, someone just posted in the chat, that culture may pose a bit of a challenge. Nurse practitioners have been in existence here in North America for several years, and they're sort of part of our expectation within the care continuum. I think in Nigeria, there's sort of this sort of cultural barrier we would have to overcome, to see nurses in a provider role, to see nurses as well qualified, educated healthcare professionals who can, essentially diagnose and manage, patient care challenges. That's one. Having some of these conversations over the last couple of days, someone did mention sort of the standardization of programs in Nigeria. So there are several different sort of levels, depending on the school, region, location, wherever that's at, so the quality of the outcome might differ, but, obviously that's where accrediting bodies would come into play, to help sort of monitor the outcomes and quality, for these universities. Physician opposition, and that's something we experience in North America too. So that's not a slight on Nigeria or, any other country. I mean, that's something we would have to contend with. And another thing that we would also have to contend with is how advanced practice nurses would fit, into the continuum with physicians and also pharmacists in Nigeria. Pharmacists, sort of have this pseudo provider role, so we would sort of have to completely reconceptualize, roles of providers in Nigeria to ensure, nurse practitioners genuinely are able to practice at, at their capacity, to be effective.
Amazing. And, you guys have said quite a lot, but I'm also trying to follow the chat box, and there are some great inputs here. I mean, someone mentioned culture being a significant barrier, political instability. I think I did also read something about, the initial ANP attempt in 2011 thereabouts, which was also supported by the University of Maryland School of Nursing. I don't know what happened with that. Structure of the healthcare system is a huge deal, which I think you both talked on. Being able to create that space for nurse practitioners, and the need is there, the success stories are there, and I think we're starting this conversation. I think it's a huge deal, HFN. Thank you so much for kickstarting this. I want to take this opportunity to acknowledge the presence of the Director of Nursing, Lagos State, Mrs. or Madam Dorcas Shonibare, and the Deputy Director of Nursing, Abuja, Mrs. Franca Okafor. I know that we do have a whole lot of authority on this topic here. I may not be able to identify each and every one of you, but we want to thank you very much for being able to be a part of this conversation. And if you're able to just, send your inputs via texting in the chat box, that would be very helpful. We would love to hear from you. And some of you may be invited at a later time to be a part of this conversation. We hope to be able to benefit from your wealth of knowledge, especially considering that you have significant experience within the Nigerian context. I have also some messages that were pre-sent before the start of this event. One of the first questions that I have here is, how will this be feasible in Nigeria? I mean, how will we encourage that they create a nurse practitioner school in Nigeria? And I think some of these things you have already touched on in your conversation. So I would like to kind of like marry that with the next question that talks on how our nursing schools in Nigeria are unequal, and how it will be difficult to regulate or even implement this. Dr. Idzik, a lot of this you've already spoken about.
Yeah.
But feel free to add anything else if you want to.
Sure. And I do think, I think certainly, I think, standardization, I'll tell you one of my statements is, I always say it in education here in the States, right? So often we get the statement that in order for nurses to come into nurse practitioner programs, they should have X number of experiences, right? They should have been a nurse for X number of years, right? And my comment to that, and I think it would probably hold true in Nigeria, is as academicians, our job is outcomes. Our job is to assure that they've met the standards when they exit the program. So regardless of the amount of experience that they come to me with, right, their nursing experience, and they come with varied nursing experience, right? So we certainly have nurses that come into our family nurse practitioner program who have primarily experience with adults in their nursing profession and minimal experience with children. And it's our job as educators to get them to that level, that minimum standard. So I think that's one way to strategize around it. Again, that puts the burden obviously on the advanced practice educators to kind of level that standard. But I do think, we face that, and I think other countries face that. if you've seen a nursing program, you've seen a nursing program, right? They're all different. And I often say to people, in some ways, thank goodness, because if we're all the same, then we could just have one big, gigantic, school of nursing. But there are different schools of nursing, and there are different ways to, philosophies of approach patient care. So I think it's about minimum standards, and I think some of it is about the outcomes. I wanted to go back to comment a little bit. Someone had made a comment, which I think is interesting. And, I hadn't really thought about it a lot until I read an article on task shifting. So someone had made the comment that maybe the first barrier would be nurses themselves, right? Being interested in advanced practice nursing. And I read an article, it was called, and I'm just going to read the title to you because I pulled it up. It was called Predictors of Willingness to Task Shift Among Family Planning Providers in Southwestern Nigeria. And what their conclusion was that older registered nurses or registered nurse midwives were aware of task shifting and more willing. And I don't think that's, it's not an exact in any way, transition to advanced practice nursing, but it was interesting, who was willing and who wasn't. I think for a lot of people, most people feel comfortable doing stuff that they feel prepared to do. If you feel unprepared, then I would imagine people would be less willing. So I do think that is something to consider, in preparing people to do the work, is that they really do need to feel like no one wants to do a job that they don't feel like they're doing a good job in. So it doesn't make you feel good when you get up in the morning. So Bim, any other thoughts on that?
It's a multi-dimensional problem that would require significant creativity, and as you mentioned early in your presentation, persistence. I'm reading the chats, and I'm providing some responses here also, and I think we as a people need to own this challenge and understand how significant it is. And I think Nigerians are very resilient, just like nurses, they figure out a way. They found ways to do so much with so little, and we kind of have to understand that that's not necessarily acceptable. I mean, when you look at morbidity, mortality data, I just feel, Nigerians as a people, need to sort of accept the fact that, we need we need better access to healthcare, so global issue, and, sort of start to diminish some of these barriers, just so there's, an opportunity to, objectively evaluate some of these options. There's some posts in the chats that, even nurses need to be willing to accept this as an option. Our physician colleagues need to accept this as an option. I remember working in Nigeria, working on a project in Nigeria recently, and the number of physicians registered in Nigeria was 35,000, and that was a solid number. If you do the same research today, the data shows it's 25 to 35,000. Brain drain is sort of an introduced factor now. So lots of people are leaving, so even though we're not saying it because we're resilient and we've been so flexible, to just be able to sort of make things work, we have a healthcare crisis in Nigeria. We have a healthcare crisis, and at some point we need to do something about it. So that's kind of how I feel. I mean, all the barriers are real, but other countries have experienced the same barriers, and with persistence and a level of understanding and support, they've made it work. It's not pretty, and I don't by any means think it will be easy in Nigeria either, but I think the timing is also right. I think this is a good time, to start to be, to just be open to some of these ideas. So that's all I'll add.
Awesome.
Thank you. Shola, let me make one quick comment if you don't mind about that, because I do think, the consummate educator, academic person that I am, I always think there's probably a solution in the literature somewhere. Not always, there's certainly not always, but I often go back to that. I always think there's probably a solution somewhere, right? And so, as I was doing reading, I found a group that had used, they call it the Peppa Framework. And that's how they built and implemented their program. And I thought it was really fascinating. I love when people use frameworks or kind of models. And I think that helps us, because we can say, all right, well, it worked here, maybe that will work. It worked there, maybe it'll work here. And it was a framework that talked about, it was participatory, it was evidence-based, it was patient-focused process for advanced practice nursing. That's what it stands for. And it said it provided a context to consider essential interconnectedness in the roles of education, policy, regulation, and practice in the development and implementation of the family nurse practitioner role. So I think that's another thing to look at, is what are there frameworks or models that can be used as well. And again, like Ben said, probably there are other countries who have gone through the battles. I think that's really helpful. I have a student right now working on tax credits for clinical preceptors in the US, because some states have been successful and other states haven't. So she's gathering the information on every person who's been successful and all the information on those who haven't been successful in passing this legislation, because we have as much to learn from our unsuccessful experiences and what we did wrong, as we have to learn from what we did right. So I hope that helps in kind of thinking about next steps as well.
Amazing. Thank you, Dr. Idzik. And, interesting conversation here. I'm sure there's no way we can exhaust all of this conversation, but it's really great, catching up on some of the ideas around here. I think I read something from Dr. Shegun Adeoye that spoke on the ABIE program in Ondo State. I don't know a lot about that program, but, it speaks to the fact that if that can be successful, I know it was a maternity program that was done or implemented within Ondo State, and it still exists until now, and it's not restrictive to just the physicians alone. I don't have a lot of information, but I also know in Lagos State there's a lot of work being done with traditional birth attendants, and if we can work with traditional birth attendants to fill the gap, why can't we have nursing practitioners, right? I'm seeing conversations here about people talking about taking it to the National Assembly. I'm not sure if that is where we're going to start from, but I know that is probably where we may end up at. So this is a great conversation. Some of the questions that have been sent previously, I'm going to take one more, but just before that, I'd like to invite one of the board of directors for HFN, Health for Nigeria, Dr. Duyile, is it Dr. Duyile or Dr. Ilukpeju? Dr. Akintade, help me here. Dr. Ilukpeju. Dr. Ilukpeju, one of the board of director members, Dr. Ilukpeju, to just share what his thoughts are on some of the conversations we've had here. Dr. Ilukpeju, can you unmute yourself, please, sir?
Is it okay now?
Yes, we hear you now, sir.
Okay. Good morning, everyone. I'm a Nigerian making a difference, and I'm an OBGYN. I've been in practice in Maryland for more than 30 years. I consider myself to be right, left, and in center of the topic at hand today, this morning. I enjoyed the lecture by the professor, Dr. Idzik. She's quite right on the point of where we are. I've been in practice. I'm a board certified OBGYN, and I've been involved in the training of nurses for quite a while. Let's start from 1992. That was the first time that some schools that were started by some Nigerians were looking for sites to train LPNs, when it's time for them to do their rotations in maternity. So they found me, and that's how I got started. So they were coming to my practice, to do their 6 weeks clinical rotations in 1992. And Aprn was the nursing advancement of the moment at the time. And then from there, we graduated to the nurse practitioner program. And then the schools found me again, and they were sending their students to me for the clinical rotation for their students, which continues until today. Even yesterday, I have 2 students in my office. Schools from University of Maryland, Coppin State, Bowie, GW, South University, name it. They found me, So really, I'm already sold on this idea. I go on several medical missions to Nigeria. So I'm like an expert on all things, that we're talking about. All things that is wrong with the healthcare system in Nigeria and in Africa as a whole. The lack of healthcare infrastructure, the infant mortality, the ABA program, which I was involved with, when I was doing medical missions with Dr. Duyule to Ondo State, with Governor Mimiko. I've done surgery in Nigeria. I've seen patients on several medical missions. So I'm really the population explosion in Nigeria, where the capacity for healthcare is totally overwhelmed. The brain drain, the physicians living in droves to Saudi Arabia, to UK, to the US. I mean, the pandemics. So where do we actually start? Let's look at the United States, where we have more than 500,000 physicians, and it's still not enough. And that's why the nurse MP program is introduced, with some resistance, which continues from physician groups and all that, but it's here to stay. So if the US with so many physicians can really embrace this program, then what can we say of Nigeria with population of 200 million, and we have only 25,000 physicians, many of which are living. So we have our work cut out for us. This is a program that needs to be implemented in Nigeria. When I hear them say that Botswana has had this program for more than 40 years, a lot of countries in the Caribbean, I mean, so we just have to start the discussion, the narrative, the conversation has to start right from now. We owe it to our people. We don't owe it to anybody else, but to our people who are marginalized, who are dying of needlessly dying, the mothers who are trying to have babies and dying like flies. I've seen that firsthand in Ondo State, everywhere. So I don't want to hog the microphone. It's something that I'm passionate about. I've had since 1992. I can safely say that more than 1,000 nurses have gone through me. I mean, you can take that to the bank. So this is something that I'm as I winding down my OBGYN practice, I'm picking up mentoring, training. So I really applaud Dr. Akintade, the founder of HFN, for all the work that he's been doing. He already articulated what we're all about. I'm just a supporter, as you can see. So, I thank Dr. Idzik for this lecture, and I think we need to get the conversation going and the narratives. We have our work cut out for us. It's not going to be easy, but it has to start somewhere. Thank you.
Thank you so much, Dr. Duyile. That was Dr.
No,
Duyile.
Dr. Ilukweju.
This is Dr. Ilukweju.
Okay.
Dr. Uluren.
Dr. Ilukweju, thank you so much, sir. Well,
They're actually both board members for HFN.
Okay, so yeah, so he's also a board member with Health for Nigeria. Thank you so much for all you're doing for us. And you did say that very nicely. We have our work cut out for us. So one of the questions that were present here is that there are shortages of nurses. So, I mean, who are the target people that we think will become the nurse practitioners? Are we thinking of upgrading some of the nurses, existing nurses, or are we hoping to recruit afresh people to start the first level of nursing program and then transition into the nurse practitioners? What would be the most ideal vision for starting this program? Dr. Idzik, what are your thoughts?
I think that's probably a better question for Nigerians to answer. But I would say, one of my thoughts, and Bim and I talked about this, I thought it might be interesting to see if we could find data on if there was increased enrollment in any country as they increased enrollment in nursing programs as they started nurse practitioner programs, right? So, I don't know if it's out there. I couldn't find it easily, but I often wonder if empowering nurses in another way may increase people's desire to join the nursing profession. So now, again, whether that's true or not, I don't know. But I do think I would say myself, if I were starting a nurse practitioner program, I would take experienced nurses that are already experienced nurses and bring them back to nurse practitioner programs with the hope that it will increase interest in nursing. I think, where we are today, there is a global nursing shortage, but there is a healthcare provider shortage as well. And so the other thing I always try to remember, and I say this all the time, I am a nurse, period. I am a registered nurse. And so when I went back to nurse practitioner school, I didn't cease to become a nurse. I am still a nurse. Deep in my soul, that's what I do every day. I do it with additional education. So I think that's one thing to just kind of keep in mind, is that we're not stealing the nurses and doing something, teaching them engineering. We're just giving them advanced education so they can improve the healthcare for Nigeria, which is our why.
Nicely said, Dr. Idzik. I see Dr. Elsie Jolade nodding and giving you a thumbs up there. If it's okay with Backend Tech Group, I would like to invite Dr. Jolade and maybe Dr. Inri Loye to just also, chime into this conversation, because they're on ground in Nigeria. They're nursing experts. They have wealth of experience, and it'll be great to hear from both of them. So we'll start with you, Dr. Elsie Jolade.
Yeah, thanks, Charlotte. I thought you were going to ask me. I was going to defer to them because they are the ones who are in Nigeria. Thank
you. Good morning. I live in New Jersey. Good afternoon, and all my colleagues all over the world. I am so excited to be here. I literally stumbled on this invite, and I got here and I see all my people, Dr. Akintade, Dr. Ilioye, Dr. Idzik, everybody. I'm like, oh my goodness, this is a wonderful place to be. Nigeria is on the top of my heart. I love giving back. I love going there. Though I have left Nigeria a very long time ago, but like Dr. Ilukpeju said, we wanted to do more. We want to go back. We want to see what we could do to make Nigeria a better place. At the end of the day, what can we do? I understand all the valleys and the hills that we have to jump over and to climb, but a journey of 1,000 miles starts with the first step. So I want us to keep the goal in sight. I don't want us to look at all the obstacles why we cannot do this. Let's start with what can we do starting now. Dr. Irioye, I'm so blessed to see you here. I'm so excited to see you here. Several years ago, I sort of like communicated with her, did something with her at University of Ife, and it has been like, okay, what do we do next? What do we do next? What do we do next? So UniMed, Dr. Akitade, Dr. Tiko is here, and University of Medical Sciences in Ondo City. I'm very involved with so many things with them. I was there a few months ago, collaborating with the nurses and a few other people that I do. I'm probably going to be there again another month or two. So please, we can totally do this. I believe we can. It's a matter of, we start with, remember how we do here, Dr. Idzik. We start with a pilot project, right? We do a very small group. Then we make it bigger. Then it becomes global. If we look at the global first, then we are not going to be able to do anything. Let's start small. Let's start small. And then we build on it. Build on it. That's what I think we could do. So I'm so glad to be here. Dr. B. Makitale, nice to see you. You're looking wonderful. Please pull me into the fold. Whatever you want me to do, you know I'm more than 110% ready to collaborate with you at any time. Thank you so much.
Thank you so much, ma'am. That was Dr. Elsie Jaladi. Thank you for chiming in. I think you said it so well. Journey of 1,000 miles. Start with that very first step. I couldn't have said it any better. I would at this point also want to invite Dr. Arinoye to speak. And then right after, if I think it's Dr. or Mr. Akin Otiko, the Acting Dean Faculty of Nursing from the University of Medical Science, Ondo. If he also has input right after Dr. Arinoye, I would love for him to come on board as well to just share some of his own insights on what the possibilities are for nursing in Nigeria. And like I said, this is just going to be the first of many conversations that we hope to have to take or to advance this concept forward. Dr. Arinoye, the floor is yours. We may have a few minutes for you, but we know you have a lot to say to us. So please just help us, put that in the concise and, very...
Just 2 minutes.
2 minutes. Thank you, ma'am.
Let me just thank Dr. Idzik, Dr. Akitade, Dr. Jalade, and I am sure they know my mind and they know how far we have gone. I'm just finishing a session where my department just was concluding revising our strategic plan. And we just got back to reviewing our curriculum and bringing in the Advanced Nurse Practice Program as one of the options that we think we want to bring on board. And like I said, this course has been on since 2011. And it is just also, this idea, again, coming from University of Maryland, again, is just an encouragement for us. I think the discussion, the discourse, the action is very right now. And we've kept talking to all the people that matter. I still spoke with somebody from Nursing and Midwifery Council of Nigeria that it is high time we get back to this discussion that we started in 2011. And I think with the support that we are having from your end, Dr. Jalade was in my university to come and discuss the Advanced Nurse Practice Program. And since then, we've been following it up. I think this group just needs to have a structured intervention in terms of how do we move from here and how do we actualize what we want to do. My department is ready for a pilot. And we also have experiences of how things have happened in other places. I've been part of starting a program. I've been part of starting a master's program in Rwanda, supported by universities from, by several universities of the US. So if we say we are ready, we just need to work together and then say, what will be the step by step of how do we move from here? And you can call on me any day, and I'm assuring you that my department is ready to be at least the starting point of the pilot study. We have students, we have postgraduate students that express the willingness to do the Advanced Nurse Practice Program. But we can't run this program without support from experienced and without people who have been part of managing the program. I'm just happy that we're starting up. And I want to thank Dr. Akintade and to say that I'm going to be waiting for next line of action, and please give me work to do. If I need to go to Abuja, if I need to go to anywhere, I can go to anywhere. And I'm not just saying this because I'm in Ife. I'm saying this because I'm in a position to mobilize the university programs in Nigeria. I just became the president of the Association of Nigerian University Programs. And we're taking it on board that we need to start this program. By the time we start talking of having a pilot, all the other things that we have to do, we keep doing them. So please, I am in. Just give me work to do. And I'll be very happy. And I'm happy again to say that it's still University of Maryland that is driving things. Thank you.
Thank you so much, Ma. We couldn't have gone through this entire lecture without including you. I mean, you bring it all together. And congratulations on the new position. It will be definitely very relevant to the conversations that we're having here today. Unfortunately, we seem to be rounding off to the end of this first conversation on the vision of the nurse practitioner program in Nigeria. So I want to just reassure everyone, because I've gotten quite a lot of side messages telling us to make sure that we share the content and future meetings with them. So please be rest assured that this video and other future contents will be shared with every member of this group. You will be on the HFN database unless you choose to exit at any point in time. Thank you so much, everyone, for coming. And I will, at this time, hand over to Dr. Akintade to give the vote of thanks for this event. It was great to have you all here. Thank you so much for joining us and for your patience. Dr. Akintade?
So thank you, Shala. I mean, as usual, you do a fantastic job facilitating and moderating these conversations. So I truly appreciate that. On behalf of Health for Nigeria, I would like to thank everyone here today. I know we have people represented all over the world, here in North America, in the UK and Nigeria. Thank you very much for creating time on your schedule. I would like to thank my very good friend, and she is, if we could dub her, an honorary Nigerian. She has spent so much time on this presentation. She said she has never worked this hard on a presentation before. Shannon, you're a friend, you're a colleague. I truly appreciate it. Thank you so much for doing the work and not just making this a presentation, but for wanting to be a part of this process. When we first spoke about this, she demonstrated a ton of interest in actually being a part of the process, which is laudable. So thank you very much for taking the time. You did a fantastic job. So we will find you a Nigerian name, and
I have one in mind already. Kenny.
Please share.
Kenny.
Wonderful.
Yes, so thank you so much. The next steps for everyone who is curious, this was an introduction, and we truly understand that we wouldn't be able to cover everything or answer every question or delve into every aspect of this discussion. Hopefully in the next couple of months or so, we will have further discussions. We'll get the right people at the table to have a panel discussion. We will do our due diligence. We'll get as much information and data as possible. And there we will try to, investigate further, what this could potentially look like, and, where we could actually start putting down our building blocks to lay a foundation. So until then, once again, thank you so much to all the organizations present, all the state and national representatives, the universities here, the nonprofit organizations here, my alumni members who are also here from Nigeria. We appreciate you, our Health for Nigeria board members. Once again, everyone, have a fantastic Thanksgiving holiday break. We truly appreciate you. Thank you.
Right. Thanks, everyone. See you next month.
Thank you. Thank you, everyone. Bye.
Nigeria's Health for Nigeria believes the healthcare sector needs an inspired and well-motivated group of young leaders to canvass and act for excellence in the healthcare standards of Nigeria.
Good day and welcome to 2021. My name is Dr. Olu Oshonsami. I currently reside in Wichita, Kansas, United States of America. I own and operate a physical and occupational medicine clinic. We cater to the rehabilitation of injured workers, motor vehicle accident victims, and patients with disabling medical diseases. I'm glad that I got my upbringing from the great College of Federal Government College in Idwani. My clinic is very essential for job creation and the well-being of the entire Kansas. I wish you all well, and may Nigeria ever go stronger. Thank you.
Hi, I'm a psychiatrist in Nigeria, and I'm making a difference.
Hello, hi, I'm a pharmacist, and I am a Nigerian making a difference.
I'm a family physician, otherwise known as a GP in the UK. I'm a Nigerian, and I'm making a difference.
I'm an OBGYN in the USA, and I'm a Nigerian making a difference.
I am a medical doctor, a general practitioner, and I am a Nigerian making a difference.
Yeah, I'm a practicing internist and geriatrician, and I'm a Nigerian, and I'm making a difference.
I am a heart transplant surgeon in Boston, Massachusetts, USA, and I am a Nigerian making a difference.
I'm Seb Oiwo. I'm a dermatologist, and I'm a Nigerian making a difference.
I'm a clinical researcher living in Canada and a Nigerian making a difference.
My name is Dr. Joshua, and I'm glad to be here making a difference.
My name is Fatima from Lagos, Nigeria. I'm a pharmacist and I am definitely making a difference.
I'm a family doctor and I'm making a difference.
I am a general health practitioner and I am a Nigerian making a difference.
I am a school health nurse in Nigeria. I am a Nigerian and I'm making a difference.
I am a respiratory care practitioner. I am a Nigerian in the United States, making a difference. Happy Independence Day.
I'm an orthopedic resident doctor in Nigeria. I'm a Nigerian making a difference. Happy Independence Day.
I'm an internal medicine physician in Houston, Texas, and I'm a Nigerian making a difference. Happy Independence Day.
Good day, everyone. Health for Nigeria, thank you for what you're doing, and we appreciate you for all that you have done so far. I am a Medical and Dental Council of Nigeria certified general practitioner with interest in public health management. I currently work as the program manager for the Ondo State Tuberculosis, Leprosy, and Buruli Ulcer Control Program. I am a Nigerian, and I am making a difference. Happy Independence Day. God bless us all. Amen.
Health for Nigeria, health equity for all Nigerians.